What really happens is that you go through a full, thorough process to evaluate your candidacy to be on the transplant list. And that involves us as physicians looking at you, the surgeons looking at you, making sure it's safe for us to do those things. We bring in other physicians as needed depending on what other medical problems you have, infectious disease doctors, gastroenterologists, pulmonologists, anybody that we think may help us decide whether it's safe for you to be transplanted. So we do a lot of this evaluation, and it requires a whole team. We have a true, large, multidisciplinary team that we would not be able to take care of patients without them. Once that evaluation is done, we meet as a large committee. We review the case, review all the data, and we make sure we think it's safe for them to be transplanted. Then we put them on the list. Now, being on the list does not necessarily mean you can be transplanted right away. There's only 2,000, 2,500 transplants done in the United States a year. That's probably less than 1% of what's necessary. But once you get on the list, a lot of that is based on how sick you are. Many times in the middle of the night, when we're getting called about organs, we make that decision. The surgeon goes and gets the organ, brings it back. They do the surgery on the patient, and then that patient gets transplanted. Our wait time is one of the shortest in the state. We are also very fortunate that we have the best outcomes in the state for transplantation. We have patients surviving at 1 year and 3 years at about 94 to 95%. That's amazing. When we talk about patients with advanced heart failure not making it through the year, and now having a almost normal life expectancy is incredible.